He is one of our senior in AFESINDO, Asosiasi of Modal Ventura Indonesia. Hi, Pak Jeffrey.
Yes, hi. Good afternoon.
Good afternoon. And I would like to introduce to our buddy, Dr. Bimo, for amazing event that he hosts for today. Are you here, buddy?
Yeah.
Okay. I would like to start the event with the warm welcome from Dr. Bimo. Your time, Dr. Bimo, to get a speech.
Okay, thank you so much. So there is to Mr. Jeffrey here.
But the screen is on Mr. Jeffrey here. Panitia.
Yeah.
Bisa langsung fokusin ke Bimo. Okay. Sure,
so,
man.
Good afternoon, everyone. Thank you for your time with us again after having your lunch, perhaps playing a bit with your children. That's what I've just done actually. I have a 3-month-old babies, and yeah, it's a good weekend. It's a good weekend. It's a good time to share, and we hope that with for the third session today as startup pitching. So we got entry for so many Indonesian health tech companies from our members, and the committee has selected top 6 from, I think that was already shown before. We are going to have from Indonesia is Brave Healthcare. Is Brave Healthcare already here, the team?
I think so. Si Rafi.
Madeena, Gigi.id, Farmasee.id, Ctscope, and Ideanesia. But we are going to have a very nice introduction and session of the guest pitching from Hong Kong Cyberport, from Ctscope and Virtual Control. So without further ado, I would like to ask Mr. Jeffrey Sirait to have an opening remarks from the Indonesian PC for Startup Association.
Yeah, thank you, Dr. Bimo. Good afternoon to all startup health tech competition. All the participation from Indonesia and Hong Kong, AI and deep technology in healthcare actually. First, I would like to thank to Hong Kong Economic Tech and Office Investment, Hong Kong Cyberport, and also for you, Dr. Bimo, as the chairman of Indonesian Healthtech Association, for holding the Startup Healthtech Pitch Day along with the ecosystem supports. Also for the investor and all the venture capital who is participate in this event, attending in this event today. So I believe that this will have a planned event would allow us the opportunity to accelerate the technology innovation within the health sector, which would greatly contribute to the economic, especially during the pandemic. We came from AFESINDO, that's the Venture Capital Association for Indonesian startup, constantly and intensively also communicate with our colleagues from Indonesian Healthtech Association to deeply collaborate for the innovation development that we currently strive for. We believe that today Pitch Day would allow all the startup participation to communicate and improve the existing innovation to be developed further and to be able also to compete in constructive business environment. So let us all utilize this opportunity for the innovation development of Indonesian and Hong Kong health sector actually. Moreover, I would like to thank to the committee for the contribution on today's event and also for the upcoming ones. Wishing all the success for Indonesian health startup and success for you all. And I think this is the collaboration very good for us to have a better understanding and improve together, especially for the health tech sector. Thank you, everyone, and success.
Thank you.
Thank you, Pak Jeffrey.
Yeah, Bimo.
All right. I think this is my turn to introduce our honored jury, honored judge for this pitch event, pitch day. I would like to introduce you with Mr. Rimawan Yasin. He is one of the director for Ventura Giant Asia. Are you here, Pak?
Yes, good afternoon, everybody.
Good afternoon, Pak Rimawan. Okay. The second judge for our today event is Pak Andreas Surya from Kejora Ventures. Are you there, Pak? Pak Andreas Surya? Oh, he's not here. Pak Andreas?
I'm back.
I think he was actually already here.
Yeah, oh, here. He's
back,
here.
I'm back.
He's
Sorry.
here. All right. Okay. So he is also my mentor from Kejora Ventures. And the third judge is Pak Niko Azhari, Dr. Niko Azhari, one of our seniors doctor from in Healthtech Association. Good afternoon, Pak Doctor.
Hello, good afternoon. How are you?
Hello, Pak Niko. Okay. Okay. Let me start with the startup that we will pitch. The first and the second startup is from Hong Kong. We will have them presented first before Indonesian startup. So I would like to welcome Albert. Are you there? Hey, Albert.
Good afternoon. I'm here.
Good afternoon. Okay, so this is your before we start, there is something that I would like to inform you because we didn't have the brief session for the pitching. There are 10 minutes for the pitch and 5 minutes for question and answers, right?
Yes.
Then the presentation will be in English. Then the time is yours now.
Okay, good afternoon, friends in Indonesia. This is Albert from Hong Kong Cyberport. Thank you so much for allowing us to share our startup journey. So what Case will be doing is we are more focusing in the community healthcare. So I just want to know who and how your family elderly being taken care in Indonesia. But in Hong Kong, we used to put them in the nursing home, or we sometimes luckily that we will keep them at home. Like my elderly at home, which is my grandma, she's already 90s. We want to keep her at home to give her aging in place. But at the age of 90, she got stroke, she got glaucoma, she got all this kind of difficulties. For us as a family caregiver, it's difficult to take care. So probably every one of you may have a WhatsApp group. The WhatsApp group may use to discuss what to go for dinner or what kind of activities we need to do in a family. But for us, our family WhatsApp group is how to taking care my grandma. Especially she got a lot of appointment consultation in a weekly basis. Luckily or coincidentally, in my family, we have 2 doctors, 2 nurses, and 2 pharmacists. So you can find that over the WhatsApp communication, it is quite complicated in talking about different kind of care treatment or procedures. But is this pretty the same for other family members in taking their elderly at home? Definitely. A lot of individual, when they need to take care of the family, they have different things they need to manage, like discussion with the family doctors, pharmacists. All this information are fragmented. But we all know that all this healthcare is not one size fit all anymore. Even for cancer, there's a lot of different kind of treatment for all these chronic disease. So there will be more personal, I think, we need to address for all this elderly or people which require chronic disease support. So is this only my family problem? Definitely not. I just would say in Hong Kong, we are in the aging stage. That means for the age 65 plus people, now in Hong Kong is about 1 million. But in 10 years later, that will be double, which is 2 million. And of course, the age of 80 plus will even grow a lot. But in the same time, like globally, especially now, most of the people that they need to fight for COVID, we all know that the healthcare resources, professional resources, is very exhausted or limited, especially those people which work in nursing home or in home care in Hong Kong. That take a long, long time for the elderly in Hong Kong to get into all this kind of facility or institute to take care of them in that kind of inpatient setting. So what we need to do is we want to make it more easy for the family to take care of the patient or the elderly at home. So what we need to do is not a magic that we all know in the hospital, we all have a patient chart. We all have those kind of very well organized system to take care of the patient. But that is not in place in the community healthcare or in the public. So that what we did is we integrate a system or we build a system which like the patient chart system or the care plan system integrate with all these kind of communication tools, which is Line, WhatsApp, WeChat, and that is our solution, Team Care, which is that is an APP, but the meaning of APP is affordable, portable, and personal. So what we did is the solution is like a Salesforce or CRM solution, but this
10
is
minutes. 5 minutes.
okay. Thank you, sir. So our solution is just like a CRM solution, but the customer is not only customer; he or she is a patient. So it is a patient relationship management system. Keep track all the patient record over there. So we have the ERP over there, patient care plan over there, so that all the family can easily keep track together with the professional in the service provider. So how the application work is just connect all people for self screening, assessment, care plan, education, and all these things. And most important is the family can easily check all this kind of planning or resources online so that they can do the support with them accordingly. So how our solution work? We already developed our application as a SaaS base. It's a called Team Care Framework. So what the client can do is they can simply adopt our solution like a SaaS model. They subscribe our solution. Or some of the customer, they want to customize their solution, which is only fit for very specific need, like for carer need, or for volunteer support need, or for dementia need. They just customize our solution built on our framework. The beauty of this solution is one, this is already a ready solution. They can simply adopt this model. Two, this is a subscription model, which is they can not need to wait and buy the solution. They can subscribe it just like the online solution like Zoom. Just subscribe it, you can use it. And also it's increased the caregiver and caretaker loyalty, which is we see the most benefit over there. So the solution has been deployed in Hong Kong, which start from free academy, 6 NGO or service provider, and cover 2,500 already in Hong Kong. But what the behind of this solution and build up is we are like mentioned, we are a cyberport, we are a startup, but we also participate in different kind of competition like Foxconn in Taiwan. We already got some kind of exposure over there. We also have a very strong team with 60-year plus healthcare informatics experience. Myself was work in IBM before, and I'm also worked in health tech for 20 years already. And we follow the HL7 standard in deploy our solution. So we believe that the solution can portable in different regions. So what our vision or ambition is, our solution will, from the specialist perspective, is we go from elderly and then we go for baby kids and also chronic disease. From the setting, we go from community care and go to more like inpatient setting. For the geographic, we'll look for Hong Kong and also Malaysia, Singapore. We already have a customer in Malaysia doing the baby care services. And we are addressing is about 5 academy 10 service provider and cover 50,000 family and elderly this 2 years.
2 minutes.
Okay, what we need from you is, because as we mentioned, we would like to expand. We want to have more talent and people to join us. Especially, we want more local and regional referral, because different location with different kind of healthcare system, we may not know how to deploy or integrate our solution together. It would be good to leverage this platform to connect more expert in Indonesia and see how our solution can be launched in Indonesia in the near futures. Finally, it's some kind of strategic and impact investment we can looking for. So if you want to connect with me, please simply email to me. And also my LinkedIn is www.albert.com. Please connect with us. We are looking forward to work with you all. So what we want to do is doing playing a caring role is everyone's role. So thank you all for you.
Thank you, Albert. Okay, 5 minutes for Q&A from the judge. Who's first? Maybe Dr. Nico. You have any comment or questions? This unmute, Pak. Dr. Nico is still in mute mode. Okay, your time, Pak Nico, Dr. Nico. Is there any question or?
Yeah, I thought that is you developing from Faculty of Medicine, right, Albert?
I beg your pardon?
You developing from background of Faculty of Medicine. I'm really interested on this because I'm also in the Faculty of Medicine of one of one university in Indonesia. Your background is Faculty of Medicine?
No, my background is computer science, but I also study healthcare finance and healthcare admin.
Right, right. But the question is how you collaborate with the Faculty of Medicine? In what way did you think the best collaboration that you can make with the Faculty of Medicine? Because it's not so easy actually, collaboration, but okay, can you explain?
Thank you for a question. So a couple of areas we are working with them. One is for the student in Hong Kong, they need to do some kind of community care, internship, which is before they graduate. So our solution is provide to them for them to do some kind of internship services for them or charity services. This is one way. The second thing is our solution now also some of the university, they also provide community healthcare service as a for the public health. So our data used in our system is provided for the public health faculty to do the research on how to shape the delivery, the community care service delivery in Hong Kong.
Okay, thank you.
Thank you.
Okay, next Pak Rimawan. Time is yours, Pak.
Thank you, Jeffrey. Mr. Albert,
Yes.
First question is about how many team do you have with support your startup? And the second thing is about what is your traction right now achieved?
Okay, thank you. So for us, as currently we already have 5 customers, but this year we already signed up 2 sizable project, which is already make ourselves break even. So our we mentioned our the family that we are going to cover will grow from 2,500 to probably about 10,000 to 20,000 this year because of the wrap up of that project. So for ourselves, we are having a team of 6 people in Hong Kong, but we are going to expand our team in Taiwan as well. And because 2 things is one, we want to leverage their skill set, and also we want to explore the Taiwan market as well.
Thank you. Back to Jeff.
All right. Pak Surya, Andreas Surya, time is yours, Pak.
Okay, thanks, Jeffrey. Albert, with two questions. One, can you explain a bit on how you monetize again? And number 2 is the what kind of KPIs? How do you measure this? What kind of measurements do you take in quality, or is it what kind of key KPIs do you do you have?
There's some background noise. Well, for us, it's our SaaS platform. So our key measurement or how we license is based on two models. If you are using our standard model, that will be a subscription model, a license-based model, like monthly or annual subscription on our system. If they want to customize based on our solution, that will be additional customization fee and also the subscription model, which we wrap that up. And this is probably will be our first phase of revenue. The second phase of revenue is about more data analytic thing, which is we can generate data for pharmaceutical company or insurance company.
Okay, and which one is working at this moment? Are you monetizing on both path or?
We are currently still building the first one, is how we can grow our, the usage rate. So that's because when we talk with some of the insurance company or the pharmaceutical company, sometimes they require some very specific demographic, like how many diabetes patients we have. But now, since we are still growing, we may not have that volume to address those kind of demographic need from the insurance company or the pharmaceutical company. So now we are still growing our base and also work with different kind of professional to make our product more comprehensive and more user-friendly to the patient as well as the professional. Thank you.
Okay. Is there any other question or feedback? We got 1 more minutes. Enough? Okay. Thank you, Albert. By the way, you are a guest speaker for this event, so you may also have a question or reply for other 6 Indonesian startup.
Okay, thank
you.
You
Also
sir.
also have a right for asking or question them later on. Okay. Thank you, Albert. So the second one is from Virtual Control. Are you there?
Here.
All right, time is yours, buddy.
Terima kasih. Selamat siang semua. My name is Thomas Bispham from Virtual Control. I lived in Jakarta for 2 years. Tinggal di Jakarta 2 tahun. Tapi sekarang kembali ke Hong Kong. So I will continue in English because that's about as much Bahasa as I remember. But I spent some time there while I was working with Lian Feng. My background was in logistics, supply chain. We set up Virtual Control with 2 other co-founders, Florian Meyer, Tam King. Tam had been based in Singapore for a long time, working on oil and gas, subsea robotics, remote inspections. And Florian actually had worked in Silicon Valley, where he's still based, doing learning for Google, and worked at Oracle before that. The 3 of us have known each other from growing up in Asia many, many years ago, and decided to come together to make radical transparency possible. So in terms of what Virtual Control does, we set up the company in 2017 at the end of the year to deliver machine learning platforms. We recognized in the industries that we were working in, specifically Tam and myself, that machine learning could have a massive impact. We looked at specific problems that we knew that we could solve, and within that, there were key business levers that we wanted to deliver to clients. So we focused in on specific areas where we could create value in terms of compliance, transparency, visibility through our platforms that will increase efficiency, profitability, but also protect value for our clients. And especially in the healthcare area and pharmaceutical, liability reduction and revenue assurance are critical levers for those businesses. I've given you a quick snapshot of what the company is. We're pre-Series A. We generate revenue currently from big clients, primarily through our platforms, and as a SaaS business model. We filed our own machine learning patents, both in the US as well as here in Hong Kong, and have filed global patents and established strategic partners that I'll talk about as we go into the products themselves. So in terms of the platforms we've delivered, they are specific in nature. And when you take them in consideration as a total package, they solve really niche problems, but for big industries. Our first product platform that we developed from 2018 into 2019 was a smart test lab. I had most recently worked for a big testing company called Bureau Veritas, and we focused in on the chemistry testing business, which is a global market and a very large one that we can immediately address. That product is in market today. The second product, taking advantage of our background with our team on computer vision, OCR, and the machine learning inherent in that, we have attacked the healthcare logistics market. And it's a very specific piece of that, although it's a big market. What we are doing is really working on compliance and trade verification. And I'll give you some examples of that immediately after this. The final piece is custodian, which is in development and is something that we're building for the future. But at the moment, our focus is getting our initial products out to market, delivered. But we've just acquired 2 new proof of concepts awarded through NYK Shipping for custodian just last week. So we're also excited for that development, and I'll go through those products. So in terms of the first product, it's the first platform is for chemistry testing. It's highly complex, but essentially what the program does is make the chemistry testing very simple. And essentially, many industries use these machines, these gas spectrometer, mass spectrometer machines, to analyze pharmaceutical products, food, impurities potentially in oil and gas. We've just got an agreement moving forward with the Hong Kong Environmental Protection Department to inspect air quality. But the same test, the same process, and our same machine learning platform is consistently used across all of these areas. We actually started in consumer products, which from Lian Feng and my background was something that I was very familiar with for apparel testing, for compliance, to make sure no harmful chemicals are in your clothing. But what we discovered, and as we built this platform out, the opportunities for this platform, and you can see a few screenshots in the middle, is quite vast, and we're very excited to be launching this. One thing that is worth noting
5 minutes.
Is that because of our machine learning, because of our partnership with people like AT&T and blockchain providers, we are able to secure that data transfer so that for critical testing, critical compliance, we only share data with those that absolutely require to be part of that data transfer. Moving into the inspection and the remote inspection, we're currently set up here in Hong Kong and China for SFDHL. We are working primarily for pharmaceutical logistics, where we are inspecting product as it moves through warehouses for compliance with the local or the regional requirements for labeling and packaging condition. So what we do, and here's a quick video, going through conveyor belt and coming into our inspection point, where we actually inspect and verify to make sure that both the compliance is accurate, the correct product, there's no damage to packaging, and all the conditions of that trade are met. This is an extremely high liability product, and if anything were to go wrong, the claims associated with this are very severe. And so we help protect our clients, which in this case is the logistics company, but we've also now started working with the pharmaceutical and medical device manufacturers, the big brands like Johnson & Johnson, and we're approaching new clients in that space as well. Finally, what's in development and where we've just secured some new POCs, I'll just introduce it with my remaining time, is our platform that we're looking to launch in 2021. This final platform really is a culmination of all of the development that we've been able to build, both the spot inspection as well as machine learning tools to optimize process within industry. As I mentioned, we're about to announce a big release with NYK Shipping that will take advantage of some of these tools. We're building out within that platform mobile apps that allow us to do remote inspection. And this is also very related to what we've done with healthcare in the past. Monitoring shipments, monitoring and tracking the temperature, humidity, the condition of those shipments to ensure that they go from point to point. On top of that, we maximize our relationship and strategic alliance with AT&T to provide global connectivity. We leverage their blockchain systems, which we offer as a package with our existing system. So we provide the AI and they provide the blockchain and IoT connectivity for us so that we can really scale our solutions and take them globally. We're patenting as much as possible our solutions, protecting it and building our solutions out with clients. So at this point, we are, as I said, moving forward with our development. We're currently in the middle of a convertible note fundraise that will be applied to our Series A coming up, ideally in the early part of next year, and looking for investors and new opportunities to build in Indonesia. We have several shareholders in Jakarta and in Indonesia, and both those shareholders and our company are all looking to see what opportunities. I know from personal experience, that logistics and the automation business in Indonesia certainly could use this, some of these tools, and we're looking to bring those forward to the market over the coming months. So thank you all. Terima kasih.
Terima kasih. Okay, thank you for question and answers. Dr. Nico, it's yours now.
Yes, hello, Thomas.
Halo,
Thomas.
Hello.
Apa kabar?
Baik, baik.
You have been 2 years in Indonesia and you speak very fluently. That's really good. Thank you for that. For once, I thought it's Bisping. Bisping is my favorite, one of my favorite UFC fighters. But okay, you are now fighting on the technology, right? On a virtual control. First, I've heard about virtual is actually more of virtual reality actually, because it's virtual, yeah. But maybe you express more wider technology into healthcare, but and it's good. How is your focus strategy to gain the market of at least Hong Kong now with your technology that is actually also compatible, right? I mean, Hong Kong itself, I mean, in the nationality of China, also perhaps develop kind of the technology that you build with your team. How can you compete strategically? Could you explain, please? Thank you.
Sure. One of the benefits of Hong Kong is that it's a major logistics hub, both for regionally, product and cargo, especially for air cargo and shipping cargo, whether it's coming out of China to Indonesia, to the US, or regionally. So it's a great market for us to test our products and get them initially set up here. There is competition, certainly in China. A lot of machine learning activity is going on. There are big companies like Alibaba and those SenseTime who are using computer vision and different aspects of the technology. What we found in terms of our success and trying to avoid trying to get too deep into competition is really partnering with our clients very closely, partnering with clients that are known for their innovation. So people like SFDHL, people like even Johnson & Johnson, Cathay Pacific Cargo, NYK, Houston Logistics, clients who have a vested interest. So by getting in there and being very close with those clients, we're able to expand with them and build our capabilities.
Okay, thank you.
Okay, Pak Rimawan, time's yours, Pak.
Thank you. Hi, Mr. Thomas. I have two questions for you. The first is about how you will disburse your fundraise. And the second thing, your startup is all providing the sensor of the equipment that support system, or only the system at all? Thank you.
Great questions. Thank you. First question is, we have been very lucky in the sense that as we built each phase of the product, what we find is, especially with the machine learning, a lot of the advanced the advanced value of the product develops on its own, and we can then focus our resources onto the next phase or the next product or the next upgrade for those products. So we've been able to really limit our costs, but at the same time, now we are shifting to more of a sales model. So in terms of doing that and deploying it to a wider audience, to a wider network internationally, Indonesia, US, wider in Asia, we need to support that. And so those additional volume, additional sales costs, additional representatives is going to cost more for us to build. And that's a primary focus, as well as on top of the existing R&D. Luckily now clients are, we're no longer doing, or we're trying to avoid as much as possible the free proof of concept. And so we're actually able to now charge for that. But still we need to cover with investment. Second question, in terms of, sorry, our go-to-market resources. Sorry, I blanked
No,
for.
I mean, you are also providing
the
equipment supporting to your system.
The hardware we have generally is open source. So although we will prescribe a specific amount of hardware for each product location, we've built that once and then have a very set fixed hardware cost, very simple installation cost for the clients, but we don't claim to maintain that other than as an existing service. Our main value and what we're offering and charging the client for is the system, is the platform, the software platform, cloud-based, simple SaaS business.
Okay, thank you. Back to Pak Jeffrey.
Okay, Pak Andreas, I'm sure, Pak.
Thomas, building on Pak Rimawan's question, you are definitely mostly B2B business, yeah, although you're providing SaaS. And what are the efforts that you need to do to implement this in new clients? And how long is the sales effort and how much customization you need to do? Because it seems that the solution is pretty niche.
Yeah, so there's two answers to that for the two different parts of our business. So the first product that we have for the test laboratories, we can install tomorrow or today even. That is a cloud-based system. It runs off of a secure AT&T secure network through any test lab in the world that has that machine. So as long as they're pulling that data, we're able to create a centralized data repository for them in the cloud.
Time's up, sorry. but you can finishing your answer.
Just very quickly, for that,
Yeah,
very simple, very clear go-to-market strategy. And that's why right now a lot of our emphasis is getting that product go, get to market, because we know how quickly that can turn revenue for us and get to market. The logistics, and you're exactly right, as soon as we involve hardware, and as soon as there's any setup, those are longer lead times. And that's why typically we're planning those at as sort of our next wave and phase into 2021. So immediate and longer term.
All right, thank you.
All right. Thank you, Thomas. but also you can ask question and answer for other 6 Indonesian startup. Yeah, I will give you a chance for time. Thank you, Thomas.
Bagus.
All right, the next startups will be Brave. Are you there?
Yeah, I'm here. Can you hear me now?
Yep.
All right, great. I'm gonna share screen now. Okay. All right. Can you hear me clearly?
Yes.
All right.
Sure.
It starts when I start speaking, or?
Yes, of course. Start.
All right. All right. Okay. Hi, my name is Rafi. I am the CEO of Brave. Brave delivers affordable IoT-enabled solutions for healthcare. The current healthcare system is putting more people into sick care rather than actual healthcare. We often wait for a heart attack to occur or a cancer to be discovered. It results in people only being reactive, that end up with severe cases of illness that might be too late to even be cured. This is bad for the economy because it means fewer people in the productive age could go to work. Moreover, these people need to pay highly expensive healthcare treatment to cure their disease. Even in the medically advanced countries such as the one in Europe, the number of preventable deaths reaches as high as 1.2 million in 2016. Try to remember when was the last time you got your blood and pressure checked, and how long you had to wait just for your occasional medical checkup result. On top of that, try to remember how you feel when you pay for the expensive paycheck. All that waiting just to know that you were fine. All the lengthy and complicated procedures may be enough to convince you medical checkups aren't even really that necessary until it's too late. One of my personal experience that drove me to this entrepreneurial journey is when I lost my uncle to sudden cardiac arrest. He barely done any medical checkups as he does not feel anything is severe enough to be checked. This event got everyone surprised as none of my family members thought this could happen. When I found out sudden cardiac deaths are mostly caused by arrhythmia, a condition where someone has abnormal heart rhythm, and turns out there are many types of arrhythmia, with the most common type being atrial fibrillation, and this condition may have no symptoms. People above the age of 55 have a chance of having AFib in 1 out of 5, and elevated to 1 out of 3% if that person has at least one elevated risk factor, which includes smoking, history of diabetes, alcohol, blood pressure changes, and abnormal unhealthy body mass index. The problem in solving arrhythmia is on the detecting and diagnosing. And even in the medically advanced countries, such as the one in England, 425,000 people are estimated to be living with undiagnosed atrial fibrillation. Seeing all those cases, we believe it is most important for us to focus on solving the medical condition arrhythmia. In Indonesia alone, 2.2 million Indonesians are suffering from atrial fibrillation. In the right side, we could see a regular heart rhythm or arrhythmia. In the left side, we could see a normal heart rhythm. The problem is, when someone experiences arrhythmia and go to the hospital to get a one-time ECG, the result will show in the left side, which is normal. This happens because arrhythmia doesn't happen that often in the early stage. Arrhythmia could happen only once in 3 days or even only once in 7 days. This requires a continuous heart rhythm monitoring device, and your cardiologist will ask you to wear this, a Holter monitor. You cannot mess up the word electrode as I'll mess up the diagnosis, which means you cannot let it go until the time that preceded actually ends, which is about 3 to 4 days, sorry. And you also have to go to sleep with that, and you also cannot take a shower at that time period. So it's not really comfortable for the patients. Also, your colleagues will also require you to fill in an activity journal to help them to measure relevancy of your activity to this, an electrocardiogram. The cardiologists also need to forgo a complicated process to get this electrocardiogram, and cardiologists need to sort the abnormality manually. To summarize, the current solution is impractical. Not only that it's impractical, in some hospitals, patients that want to rent this device could be put on waiting list as long as 2 to 4 weeks. One of the cardiologists that we interviewed even said the 3 hospitals that he worked with has no Holter monitor, despite the fact that he met more than 15 people in a month in average that needs one. Thus, the second problem is scarcity. Cardiologists also still recommend more monitoring time than current technology can support. Apart from technicalities barrier, it also exists financial barrier because the current solution is expensive. The solution that we provide utilizes machine learning algorithm that could automatically detect and classify abnormalities, which cardiologists found really necessary to cut reading time. Through cloud computing technology, we enable cardiologists to be able to read all the data in real time from the comfort of their own mobile phone or desktop. We also enhance its monitoring time capability to up to 7 days, way longer than the average current product, which is only 3 days of monitoring.
5 minutes.
We also have motion artifact detection that replaces the need for patient to fill activity journal. And by that, we could detect when a cardiac arrest occurs, so patient could get the emergency help they deserve as soon as possible. Our device is also locally produced and is affordable. It costs less than 90% of product in the market. This is the 3D model of our device. No wires, no messy configurations. Patients only need to wear it on their body, connect the mobile app via Bluetooth, and their electrocardiogram can be recorded and sent to our cloud, which our AI will classify the abnormalities and send it to the cardiologist. Here is where we put ourselves in the competition analysis. We provide 10 more features than our competitors and 6 more features than competitors in Southeast Asia. As you can see, the market size to solve this problem is high, and the demand for digital health service is expected to rise. With our proposed business model, we will have reached an estimated accumulated net profit of 631 USD by the fourth quarter of 2023. In this milestone slide, the green line is what we have accomplished, and the red line is what we aim to accomplish. Currently, our device could successfully transmit ECG reading wirelessly to a laptop and mobile application, and this is our patentable design and our printed circuit board that could fit in the palm of my hand. For in the future, we are aiming to be able to have a production-ready device that has medical certification and production license, so we could launch in Q1 2022. We also have several adoption strategy that will help us reach 20% of all general hospitals in Java in 2023 Q4. This is the profit to cost margin calculated in each quarter after launching. We also have this is also the comparison of accumulated profit and cost. We also have considered the risk mitigation of the startup, and this is the plan for our risk mitigation. When launching the product, we'll also utilize the resource that we get from our patients to enable us to deliver the device not only for people who has arrhythmia, but also predict the possibility whether someone could potentially develop arrhythmia based on their lifestyle, past medical condition, history of diabetes, smoking activity, body mass index changes, and blood pressure changes that will be helped by the development of more device. We could also give recommendations for patients based on their digital record activities to develop a digital therapeutic application to improve the patient's lifestyle and to implement predictive analysis, the possibility of them developing arrhythmia using recorded attributes from the device. Lastly, we see a potential providing dietary monitoring scanning by scanning nutritional facts using computer vision technology. So user could know exactly how much intake of nutrition is healthy or how much is not based on their health condition. So essentially, we also aim to be able to recommend the user nutrition intake to have a better lifestyle to avoid arrhythmia and heart problems. In order to achieve those, we need an investment of 83,000 USD, of which consists of these details. Why are we the right team to execute this project? Because we have expertise in the relevant backgrounds and we know each other pretty well, since we all came from the same university, which is ITB. We also won many notable achievements, which is Swiss Innovation Challenge Asia, Most Innovative Startup at Bandung Pitching Day, and the Most Innovative Startup by the Founders Laboratory Startup Competition. If you believe there's many problems in the healthcare industry, especially efficiency and IoT-enabled solution could be the solution, we will be very pleased to hear from you. Thank you.
Thank you, Rafi.
Yeah, thanks a lot for the.
We have 2 minutes more, maybe.
No, it's okay. It's okay. I'm ready.
All right. So the question from Dr. Nico. Time's yours, Pak.
Hello, Rafi.
Yeah. Hello, Nico.
Yes. What is your background?
Oh wait, what?
What is your background? Computer?
Yeah. So in this slide, I found many. One of the most notable achievement is the cloud computing hackathon, but we're also undergraduates. So some of us is actually undergraduate, some of us graduate. So we don't have background like in Google or IBM and stuff. So that's the difference from the startup early on.
Okay. I recommend you to answer it slowly, so you can know.
I'm sorry. Force of habit.
Yes. How can you assure that your message that is actually is a healthcare aspect, right?
Yes.
You're computer science, I suppose. And your team is also, I think, most of them is also in engineer, I think, yeah.
Mm-hmm.
So how can you absorb the need of the healthcare or health service into your things to do?
Oh yeah, so we actually partnered with 3 cardiologists, but they're not in our team. But we're actively consulting with them. Sorry, I'm trying to speak slowly now. So the part is we're actually going back and forth about the evolution of our device and where the things gone wrong, where things gone right, based on the cardiologist demand. Like for example, like we also evaluate how's this device, how's this prototype for the patient compliance, and will this really going to help you, or like for another thing, All right, so which is the most important part when detecting atrial fibrillation, and we consult about also our machine learning result to the cardiologist. But none of the cardiologists is on our team because the parts of from them is more like in consultancy, not in the core team of in the startup.
Yes, but you develop machine learning on atrial fibrillation, right?
Yes.
How many cases will you need to build the machine learning?
Mm.
And what is so different in your thoughts between machine learning and artificial intelligence? Because it's kind of different thing actually. Can you describe it?
Oh yeah, so from right now, we are actually using the data sets from Visionet, which is a library that serves internationally from MIT. So the case here, when going through actually going hands-on from doing from the library from the internet, we also are ongoing what is called, requiring or acquiring the data from local hospitals. So the part of it is actually we're developing a machine learning model, which is a part of artificial intelligence that could detect, that could diagnose which is part of the ECG is going out of shape. So it's actually let me go to the slide when it goes with electrocardiography. But this actually where a different leads. So that's lead 1, lead 2, lead 3, V1 and V2. So when it comes with the data that is input, so when it comes with atrial fibrillation, we need to first understand on how it occur and how it's different from a regular heartbeat. So from a normal heart rhythm. And so this is like a different 1, 2, 3, 4, 5 types of regular heart rhythm. So um, s- um, um, the technique or the methods, I'm afraid that I cannot really say the methods that we used or the type of machine learning that we used. So it's because it's part is confidential. But I could tell you this: um, we basically compare on contrast, which is normal heart rhythm and which is basically atrial fibrillation or tachycardia or bradycardia. So when an algorithm actually detects a difference between a normal heart rhythm and what should be not normal, they could detect and diagnose. And we don't really give 100% verdict. We forward it to the cardiologist, and cardiologist will actually cross-check, because the purpose of this is to actually help cardiologists cut reading time, not to actually replace the need for a cardiologist. Because when it comes with replacing their judgment, um, we will also give which procedure they should take, whether they should take a fibrillation or we should take an operation, and that's from the cardiologist, not from us. We will the problem is that we're trying to solve is there is the scarcity of the device, the impracticality, and the time-consuming part of actually abnormal deciding or reading the abnormalities that takes time for the technicians and the cardiologists. So presumably we diagnosed and we sent to the cardiologist, and the cardiologist cross-check to cut their reading time. So therefore, they could actually detect more patients, and these things could not happen. Like the patients that wait for 2 to 4 weeks waiting list, hopefully not happen from our innovation. So that's the part from the answer.
Okay, thank you.
Okay, Pak Rimawan, time's yours, Pak. We got 2 more minutes.
Yeah, thank you. First of all, about I asked you about did you have any traction right now? And the second thing about the team, I saw that you have a lot of care. As far as I know that now you are in the development phase. So how you manage about your resources then? Thank you.
What do you really mean by managing the resource?
Yeah, you have, if I'm not mistaken, 8 people in your team.
Yes, 8 people.
So I mean that if you're 8 people, and did you have any track right now?
Any attractions or what?
Yeah,
Oh no, we're still on the development part.
yeah, that's why. How you manage about this kind of resources? I mean, how you pay the salary of them or something like that?
Oh, so actually, we are on, we're actively consulting. So for your information, we're actually only 7 months old, and we're actually on the stage of pre angel investment, and we'll talk to some investors. So on managing about the salary and budgeting for our workers, we're actually waiting for the
Time's up.
Yep.
You may finish your answer.
Okay, thanks. Yeah. So we are waiting for the angel investment round to actually could pay the engineers behind our company. But the thing is, we know each other pretty well, and we actually believe in the same thing. So hopefully, on the angel investment part, I believe we are at least we work actually pretty well, and we're close to a close to funding. So after that, there shouldn't be much of a problem. But even though I think we're all very passionate on solving this problem, so I think we could hold on for the next couple of years, and we believe our innovation could see the light of day. Thank you.
Thank you, Rafi. Okay, the next startup would be Madeena. Are you there? Madeena?
Yes.
Okay, time's yours.
Yes, I
partner.
do. Yes, I do. Hello?
Yes, time's yours.
Yeah. Please give me screen
Okay, hold up. My
sharing.
friends will be set up.
The host has already participated in screening sharing.
Okay, hold up. Dr.
It
Bimo,
still doesn't work.
Dr. Bimo will help. Wait, pa, wait. Already? Dr. Bimo, can you help us to set co-host?
Pak Gede ya, udah co-host.
Alright. Yes. Okay, Pak, you can start.
Is that? Yeah.
Coming.
Thank you.
Yeah.
Okay, good afternoon, everybody. Good afternoon for your for attendance. I'm Gede Bayu Suparta from Madeena, PT Madeena Karya Indonesia. Yes, my presentation, company pitch deck, entitled by the devoted radiography diagnostic artisans that makes people happy during radiography diagnostic sessions. Okay. You can contact see our website at madeenaxray.com. Here's my presentation. Let me refresh my history. This is my historical track. That's why Madeena come through to Indonesia. First, I have done a long time research in digital radiography since 1990. It's 30 years experience in research and technology development at Universitas Gajah Mada. Okay. I was a top gainer in big research grant, RUT, Insinas, PPTI, from the Ministry of Research and Technology in 2005-2019. Yes. Now, I have decided to go for commercialization of the technology through our company, PT Madeena Karya Indonesia. We have exclusive technology license of my patent. I was an inventor in radiology, in digital radiography, and it belongs to Universitas Gajah Mada. Then I have exclusive technology license from my university to develop with PT Madeena Karya Indonesia. And we will brand our product by a trademark, Madeena. Madeena has already a trademark granted in 2014. Madeena made in INA. Okay, that's just about my historical track. And what we offer is an artisan high-tech product, X-ray fluorescent digital radiography. It's a complete system for diagnostic to the people. It's again, it's X-ray diagnostic system, complete system. That's already equipped and ready for teleradiology system and also all digital industrial 4.0 features. IoT, machine learning, cloud data doesn't matter anymore because it's already accessible. We provide digital radiograph. All digital, we can transfer anywhere without any delay. And we, following the pandemic, we also has adopt new normal radiography procedure, safe at physical distance. So we have already that, and we also have a roadmap for our development until 2024. What we will do in the next coming years in terms of digital radiography in every facility in the hospital. Then, what advantage we offer by X-ray fluorescent digital radiography? First, the radiography exposed will be down from 1 second by conventional to 0.1 seconds, mean 10 times faster and also safer. Secondly, radiation dose decrease from 2 milligray to 20 microgray, means 100 times down, very safe. Third, complete system. Madeena do A to Z, not only provide basic system, but also with IoT, teleradiology, big data, AI, machine learning, digital support system features. So it's a complete system. Then, of course, we also consider the price. The price, considering current global player, the price for complete system is around 3 to 5 billion rupiah. Madeena will cut down to 65%. So the advantages, radiation safe, high performance, quick service, easy operation, technology adaptive, and of course, low cost. What is Madeena seeking? We have carried out deep financial analysis since 2018, 3 years ago, and we frequently update to make sure this business is good. Sorry, maybe connection. Okay, now we are optimistic since we found our EBITDA at least at the level of 60 to 70%. This is very profitable. Therefore, in this presentation, Madeena seeks seed capital of $3 million, only $3 million, to make Madeena become the best manufacturer in X-ray health diagnostic in Indonesia, along with the teleradiology health service, incorporating with the big data of Kemenkes across Indonesia, Archipelago. That is my presentation. Thank you. I presume that the pitch deck is already in your hand, and I'm ready for your question. Thank you.
Thank you, Pak. Very, very compiled presentations. Okay,
Thank you.
Dr. Nico is yours for questions and answers.
Good afternoon, Bapak Gede Bayu Suparto. Kengken kabare. Halo.
Halo.
Good afternoon. Yes. Halo. Oh.
Halo. Kengken kabare, Pak Gede. Aduh, suaranya putus-putus ya. Oke. Ya, inovasi yang menarik ya. Ya,
Halo.
Halo. Ya, koneksinya buruk. Ya, inovasi yang menarik tentang X-ray fluorescence digital radiography. Satu pertanyaan, bagaimana cara strategi yang jitu menurut Pak Gede untuk bisa replace conventional radiology?
Ya, pertama, hampir seluruh Indonesia, most of them using a conventional radiography, not digital. So the best way to do that is doing trade-in. Trade-in, we offer our digital system, and we trade in the conventional one. That is the best way, because that has a big opportunity after that.
Okay, thank you.
That's all I think. Is that? Thank you.
Arimawan, yours, Pak. Time's yours.
Okay, thank you. First of all, could you explain to us about how you monetize this? And the second thing is about
Sorry,
the team. Can you hear me, Pak?
sorry. Yeah, please repeat the question.
Okay. The first
Ada
is,
suara anjing.
how you monetize this, Pak.
Yeah.
The second thing is about
The first, how to monetize first. Regarding the price, because we develop the complete system, we of course we are manufacturer. As manufacturer, we have already have money for that. I mean, of course we have profit on that. Second one, by provide the teleradiology system and a cooperation with Kemenkes regarding to data patient, we can provide a service in IT about the use of the data and the way to how the doctor, the medical practitioner, and the patient will pay for that. That's depend on the government regulation. We focus on the system to fabricate the system with IoT, with digital industry for teachers. So government can use that, and people make anybody can working together to serve the people. I guess that's my answer. Hopefully.
Okay, thank you, Pak. Return to Pak Fri. Silakan, Pak.
Okay, Pak Andreas Surya.
Pak Gede, has any hospital buy this, bought this?
Yes.
Sudah ada yang beli belum? And
But at the moment it's not yet. But I've already put in Rumah Sakit Tabanan. It's not because of the COVID. Doesn't we cannot finish the legal process. The second one, we are trying to deliver to PKU Muhammadiyah Yogyakarta. Now we are undergoing with the what we call cooperation, the letter. So perjanjian kerjasama.
Okay.
So that's
and,
yeah.
Yeah, and for certification, is there any certification, certificasi
Following
required?
the certification, we try to develop the cooperation with BPPT because of the COVID. Besides that, of course, we are a new company in this one. I mean, not a rich company at the moment, but if we win, we have money to pursue the certification. But in terms of radiation, we have already accredited. I mean, the system has been tested by Bapeten, and we pass, except from Kementerian Kesehatan.
Okay.
In terms of radiation, we pass.
Radiation pass, tapi izin Kemenkes belum ada sertifikasi alat kesehatan belum ya?
We need clinical trial.
Clinical trial, okay. How long is the typical clinical trial, Pak, untuk kayak gini?
The clinical trial we are usually lead by a doctor, many hospital, and yes, of course, we ask to university to lead the process, and because this is the license from the university, so I ask for a cooperation with the university because
berapa lama?
Admission.
Berapa lama biasanya?
Basically, it should be finished by 6 months. We are now undergoing process. It should be finished by 6 months. Yeah, because thanks to COVID pandemic, they asked for what we call acceleration.
Okay.
Yeah.
Is there anyone else in Indonesia developing this? or any other vendors developing X-ray fluorescent digital radiography? Not only Indonesia, but worldwide.
This is, thank you. Thank you, Mr. Andreas. This is because my innovation is already patented. And we also have a long research in that. And so far, I found there is no other company in Indonesia, even in the world, that makes this, especially because of this technology, we can cut down the price of the digital radiography. That's usually it's expensive at the moment. Yeah, this is very, very low cost system, and the technology is already available. The component of the technology is already available, supported by manufacturer. This is already in the market. But for digital radiography, we are the first.
I see.
Thank you.
Albert, maybe you can joining for question and answers. Albert, are you there?
Oh, yes, I'm here. Wow, this is quite technical for me, but just want to know how you do the clinical trial on this product, or how long it takes.
Thank you, Albert. The way to do a clinical trial, first should be there is a team of doctor and lead by the hospital, not me. The second must be approved by Kementerian Kesehatan. Yeah, there's a procedure on that. We just follow the procedure because there's already state in regulation. Yeah, and of course it takes it needs money. At the moment, we try to seek the seed capital to do that. That's all, Albert.
Oh, thank you.
All right. Thank you, Pak Gede. Time is ended. Thank you.
Thank you, Pak Jeffrey.
All right.
You, everybody.
Let's move on to Gigi.id. Please welcome Dr. Armelia.
Hello. Hello everyone. Halo Pak Andreas, Pak Rimawan, Pak Niko. Selamat sore.
Selamat sore.
Okay, can I start the page?
Sure.
Thank you. Mr. Saleh, please share the screen. Okay. Hello, we are Gigi.id. My name is Armelia. I'm a dentist. I'm a lecturer, also a researcher. According to the National Basic Health Research on 2018, there are 58% of Indonesian population, or around 150 million people, have oral and dental health problem, and only around 10% that receiving the health services. Our market validation survey identified that the key issue of going to the dentist is fear. Fear of pain, fear of costly bill, and fear due to the lack of quality information. The solution that we offer is an application that contains the following feature. First, the oral and dental health information. Second, where to find the nearest dental clinic. Third, the ability to view the dentist profile as needed. And the last one, we have a special feature by sending photos of their teeth to the application to get medical advice without having to meet the dentist directly. Our business model are B2B and B2C with three main incomes. The first one is teledentistry fee from patient. Second is patient fee to the clinic. And the third one is monthly fee from the clinic to our application, with a total income of 300 billion rupiah over 5 years. Our competitive landscape, we are the first teledentistry application in Indonesia with a social enterprise spirit. We are focusing on promotive and preventive care. For promotion, we have collaboration with Indonesia Dental Association, which they have 36,000 dentist members. And we also have collaboration with Faculty of Dentistry in Indonesia. We also have a team that has decades of experiences on their own fields. What we offer, the potential market of millions of Indonesians who has oral and dental health problem, and we are the first teledentistry application in Indonesia, where in this new normal era, the patients are required to do the teledentistry before they come to the clinic or hospital. What we need is 900 million rupiah seed funding for 9% equity, and funds will be used for marketing and application development. We also need an investor partner to help with marketing and development strategies. Our mission is to achieve equal distribution of affordable dental health services in Indonesia and then to the rest of the world. Thank you. Salam sejuta senyum, Indonesia.
Thank you,
Yeah, I think
Dr.
I'm going to
Armelia.
share one short video if it's allowed.
Sure, sure.
Ale, can you help to share the video? Mr. Saleh, are you there? So with this video, we will show a little bit more about our application. But it's not there. Mr. Saleh? Mr. Saleh, are you there?
Okay.
Okay, maybe we can continue with the question. Yes. Maybe.
All right. Maybe we can start with Pa Andreas to start the questions.
Okay. Dr. Armelia, can you explain maybe a bit more on the traction? How's the application doing at this moment? Have you launched it, and how many users and so on?
Yeah. Yes, we already launched last July, and now we have around 120 dentists already joined with us, and we have about 300 downloads our application. We just start July, launch with IDA, Indonesian Dental Association. We work together with PDGI, Persatuan Dokter Gigi Indonesia, and then we started with a webinar at the time, and the webinar attended with around 1,500 dentists at that moment. So they already know, and we have around 120 dentists already joined with us.
Okay, so it's time to get the users in, yeah.
Yes.
Okay, what is the plan?
So we have target for this 2020. We will have 5,000 users, our target for this year, and then we will have around maybe 500 dentists. Because maybe I'm also from a lecturer for Faculty of Dentistry, so I have a lot of networking, and I'm also in PDGI. I'm the pengurus besar Dr. Gigi Indonesia, so we will have work together with PDGI, and we'll ask PDGI to recommend our application. And they are so excited for our application because they are looking forward for application that only specific for dentistry. So we are the first one. That's why PDG is very excited about our application.
Okay, since there's only a very few downloaders at the moment.
Yes. We need to work more on our user.
Yeah.
Yes.
How does it work actually? Is it really possible to do teledentistry? Taking pictures of teeth and
yes, because in PDGI also just launched months ago buku pedoman untuk dokter gigi, And then in that buku pedoman, we have a flow that before the patient come to the clinic, they need to use a consultation first using telemedicine or teledentistry. And specific, and that book, they wrote it in teledentistry. So that's why we have, I think with the pandemic or this new normal era, this is our big opportunity to develop our application with dentists, also with the users, masyarakat.
Okay.
Okay. Albert, your turn.
Thank you. Wow, thank you so much for your presentation, short and precise. At least we know that how you get the revenue. So I just want to echo for the dentist. Is there any legal liability if you doing with this kind of applications?
Yes. So the Indonesian Dental Association also made regulations. So every dentist who join us for like, let's say, consultation or diagnose any case from the photos, the dentists who join us, they already have to be registered as dentists formally. So they already have license as dentists formally. We call it SIP, Surat Izin Praktek. So it's license for dentists in Indonesia. So if the dentists already have that license, then they are eligible to be a doctor for consultation or teledentistry in our application.
Okay. So I one more follow-up question. So it also allow for the first diagnosis or just follow-up diagnosis?
So this is for first diagnosis. If the need further treatment for the case, and then we will recommend the patient to come to the clinic or hospital that accordance with the case. So because we already know the case, we can what do we call it? We can inform the patient, you need to come to this clinic or this clinic. We have this case. You have to find this specific dentist or special dentist accordance with the case in their mouth. So they don't have to come to confuse which dental clinic or which hospital they need to come. We already give the first diagnosis for the case.
Thank you so much.
Welcome.
Pak Rimawan, your turn, Pak.
Okay, thank you. Just curious about this application that we can submit the photo of our teeth before we go to the dentist. In my experience, if I go to the dentist, I have to provide a paranormal X-ray.
Panoramic X-ray.
Panoramic X-ray, right?
Yes, yes.
So how it's possible that only using the photo and for diagnosis, for example. And the second thing about my question is, please tell us more about your teamwork in the company. Thank you.
Okay, so I will try to answer the question. So about diagnosis, of course, we need X-ray or panoramic. It's what do you call it? It's a tools for diagnosis. But for the first, there's a terms of it, but I forgot. So we can use our photos and also anamnesis. So we can ask the symptom, how long they feel the pain and how and when. And from the symptom, they explain by anamnesis. And together with the photos, we can try to make the first diagnosis. And if we cannot help with that, and then we can continue to suggest them to come to the clinic or hospital. But in my experience, for the first diagnosis, I think we can do with photos and also anamnesis according to their symptom and everything else without Ronson X-ray. Yes, it's only one tool that help for proper diagnosis.
How about your team?
Okay. So about my team, so me as a dentist, also a lecturer, and also researchers. I've been a dentist and lecturer for 15 years. Started 2014. I'm a lecturer at Faculty of Dentistry, Trisakti University, Jakarta. And then I also have a team Maybe I can share, yes, share screen. So this is the team. So there's RD as RD Baramul as our CFO. He is 20 years, he have 20 years experience in the bank. And we also have Muhammad Soleh, CMO, he has 15 years experience in legislative. So maybe about the law and everything else, he can help us. And we have our IT, Alvin and Auditio Perdana, and the other one is SAH. Actually, he's also our team that he have a lot of collaboration with dental hospital and dental clinic. So we have a solid team that can develop this application together.
Okay, Dr. Nico.
Yes. Good afternoon.
Good afternoon, Pak Niko.
Yes, Hari. How are you?
I'm good. How are you, Pak Niko?
Well, actually, 2 months ago, I offered my wife to for IPA for her. My wife is a dentist.
Oh,
One
okay.
app, but unfortunately, she's focusing on law, health. So you are now in with your tele-dentistry. Good for you. Um,
Thank you.
Teledentistry is one of the sexiest things to do actually, and it's feasible because I saw your apps quite similar with my platform in Vascular Indonesia. So I saw you also, you gain a lot of clinics, yeah,
Yes.
and I'm not see yet any PDGE logos,
Yes.
even that you are also already mentioned in your presentation. I think collaboration officially it will be make perfect for you to go.
Okay.
And of course, uh, uh, I want to know about what is your strategy to get the traction. Yeah, you have explained the revenue plan, but what about the traction? Because traction is also one of the important things for you to get the next revenue. Please.
Okay. So can you help? Yeah. Maybe can Mr. RD answer as our finance?
Right. Thank you. Yeah.
Yes.
Please.
Yes, hi. My name is Ardi. I'm the CFO for Gigi.id. So, if I may share a little bit about our strategy to gain traction, um, for the remainder of 2020, we plan to launch Relawan Teledentistry Sejuta Senyum Indonesia untuk Indonesia Timur. So, the approach is we will collaborate with a number of PDGI chapters in the provinces, provide initially free teledentistry services to certain clinics that don't have a dentist present. Um, to make it efficient or cost efficient, we will be collaborating also with dentists that would like to use their time to berbakti social or to be a volunteer for this program. Now, the angle for Gigi.id itself is to ensure that we get an increase in number of users, also to ensure that the doctors that participate as volunteers in the program also familiarize themselves with our platform. So they get used to using it, even though it's for initially volunteer services. We hope as a follow-on, as we get comfortable to using our platform, that they will be able to sign on and spread the word and be champions for Gigi.id.
So okay. Let me ask you about what is your competitors? Can you analyze is there any competitors like your platform?
Yes, if I may answer this as well.
Yes.
We do have a competitor landscape simple map there. Obviously, when we think about telemedicine in Indonesia, we think of Halodoc and Alodoc and QSehat and a number of in YesDoc. But I think, as mentioned before, our strength is our specialization in teledentistry. We are potentially not we are we are the first application teledentistry in Indonesia, potentially in Southeast Asia. I think focusing on a specific market particularly with the as you noted, the information of how vast the problem is of oral and dental health is in Indonesia, is a better strategy in trying to do everything
Time's
altogether.
up. You may finish your answer.
So whether in the end we continue to work on our own and expand internationally to other markets, or in the end, exit strategy could be a buyout by the more generalist telemedicine companies. But we believe we have a strong entry point into the market. Thank you.
Okay.
Thank you.
Thank you.
So we move on to our next startup. Will be Farmasee.id.
Okay, thank you.
Time's yours.
Okay,
Mas Permana.
Okay, thank you, Mas. Okay. Okay, this is my. Okay, we will start. Halo, selamat sore Pak Dr. Niko, Pak Rismawan, dan Pak Andreas. Terdengar suara saya? Mohon maaf.
Sure.
Okay, thank you. Okay. Hello, I'm Permana, a pharmacist, founder of Farmasee.id, a web-based digital platform that offers comprehensive clinical pharmacy service. Okay. Talking about clinical pharmacy, it is not only about buy and sell drugs, but also ensuring optimal therapeutic result without drug-related problems. This problem is closely related to the bad impact, not only to patient, but also to hospital and other health facility. Hospitals are encouraged to improve clinical outcome and patient safety. On the other hand, they must reduce treatment costs and staff workload. Looking at clinical pharmacy intervention in several countries, drug-related problems can be resolved. Also, improving clinical outcomes and reducing unnecessary medical costs. In Indonesia, limited resources make it difficult for health workers, both pharmacists and doctors, to provide comprehensive service, making it has a high probability of drug-related problem. Therefore, Farmasee.id is here to prevent and solve drug-related problems by pharmacists quickly and precisely. It is designed to optimize pharmacists' impact as part of the patient care team, helping to meet quality measures and adding value to value-based care. Farmasee.id is the one-stop digital pharmaceutical care of individuals in order to optimize medicine use from clinical pharmacy. Farmasee.id is powered by a passionate team. I was worked at pharmacy service for 10 years, especially 3 years in clinical pharmacy. I helped by Wawan Firjawan as co-founder that has experience to build artificial intelligence, Ren as CFO, growing strategic innovative business, and 3 pharmacists who concern at clinical pharmacy. Farmasee.id makes sure that medication regimen and care plan are optimized and tailored to each individual. We delivered the right intervention at the right time, anticipating and avoiding potentially harmful consequences of non-optimized care. Our service is comprehensive and focused on improved outcomes and lower costs of care for patients. The major feature is telepharmacy. We will use progressive web apps and utilize artificial intelligence to integrate service documentation such as recapping conversation into text. After receiving medication at the hospital, patient can access telepharmacy for counseling with clinical pharmacists. With telepharmacy, patient will also receive continuously monitoring the clinical and economic impact of the pharmacist recommendation. Farmasee.id is equipped with a drug analyzer to produce recommendation use artificial intelligence with an expert system. So patient and doctor from the hospital only must answer 7 until 10 questions, and with expert system, we can produce more than 400,000 output based on scientific data, like over-the-counter drugs that can be used directly by patient, or intervention plan for potentially drug-related problem, and also analyze. It also developed for first line therapy with dose adjustment to support doctor in choosing the right therapy. So Farmasee.id can be the best companion for existing health service. The transaction can be projected from the number of patients in Indonesia who has drug-related problem. From 32% people, around 70 million patients need comprehensive clinical pharmacy service each month. And our business model is B2B2C, with the main target is more than 2,000 hospitals in Indonesia. Using analogy, Farmasee.id is cheaper, faster, and nicer than conventional pharmacy service. Example, at a B or A class hospital, the cost of 50-minute session of pharmacist counseling is minimum 15,000. So Farmasee.id can reduce up to 50% cost for pharmaceutical care while improving clinical outcome compared to regular pharmacist counseling. Therefore, the potential revenue of Farmasee.id can reach 50 billion per year from an average cost per patient of 7,500 rupiah. Continuing with other healthcare startup, Farmasee.id is better at providing comprehensive treatment program and improving clinical outcome economically. The role model that can be adapted from foreign international telepharmacy has like Pipeline RX or Arin.io. And currently, Farmasee.id is in the seed funding stage with the main focus on product validation. So we can developing well-developed web apps to achieve a good business development. This is a projection in 1 month until 12 months. Our target is 200 hospital, and each hospital can provide 10,000 patients. At first, we were a free clinical pharmacy service provider. Farmasee.id has experience since 2018, serving up to 2,000 drug consultation sessions via WhatsApp, and each month can provide up to 100 drug monitoring therapy by phone or SMS per pharmacist per month. Okay, that's my presentation. Thank you for attention.
Thank you, Pak. Dr. Nico, you can questions and answers.
Yes. Right. Yeah. Farmasee.id, Permana Juliansyah. It's good to know that the colleague from Farmasee have a technology platform, because in Surabaya, Farmasee is also one of the trend faculty in Airlangga. So I'm very happy to have you here, and I'm interested on the idea that you brought about how to make efficient on drug delivery. What about this technology could be benefit on the patient, and also to prevent the side effects? How is your strategy between effectiving of the platforms to gain the crowds, the people, and to prevent the side effects? Because side effects of a drug is also serious things to be anticipated, right? Okay, please, can you describe?
Ya, Mas Permana, silakan.
Putus kayaknya.
Okay, thank you for a question, Dr. Nico. In Farmasee.id, we have counseling with clinical pharmacy expert. So the pharmacist who give a as a counselor he has experience in clinical pharmacy. So at a live video session with patient, they can analyze the side effect or drug related problem. And also we provide a drug problem analyzer. This is a combined condition patient and drug and a combination of drug. So pharmacists can access the result of analysis and make a decision at the right time. I think it's it.
Thank you.
Okay, thank you.
Okay, Pak Andreas, time's yours, Pak.
Mas Permana, who's your main customer actually? Hospital, pharmacist, or patient?
Hospital.
Hospital.
Hospital, yes. Hospital pay Farmasee.id, but our apps can use patient.
Of course, patient can use. Okay. Jadi, hospital pay you. What are they paying you for? What services are you providing them?
The first is counseling from clinical pharmacies who limit the limitation in Indonesia. And the second is drug analyzer for patient in hospital, in the hospital. And the third one, is we say tips pengobatan, the personalized promoting the personalized promotion to patient in hospital. Maybe I can share the.
Jadi in a normal situation, what are you replacing? What is the current alternative that the hospital is doing?
Okay, currently in hospital just has regular counseling.
Okay, jadi there's a apotheker there.
Yes, pharmacist just regular counseling in maybe 10 or 15 minute session, and after that they lost the interaction with patient.
Yeah.
Pharmacy replace regular counseling and also add therapeutic drug monitoring.
How does it work? The drug monitoring.
The drug monitoring first is with telepharmacy also. So pharmacists will communication with patient in the web apps, also in telepharmacy. It is just another session of video call. So in the first counseling in 50-50 telepharmacy, and the second session is monitoring therapy, and also patient can access we say rekomendasi obat. This is if patient need a quick recommendation for health disease.
Okay, is there another business model which is more scalable or attractive, and maybe do you think that you can probably fulfill the medicine yourself, sell drugs, sell the medicine? Instead of just consulting?
Yes, maybe this one of big potential to income, but in Farmasee.id we focus to give a service from clinical pharmacy.
Okay.
So we just recommendation best drug for patient. If patient maybe you can partner with other e-commerce, I think that.
Okay.
Okay, thank you.
Albert?
Yes, thank you. Just want to clarify that you mentioned your system can help to do some kind of drug recommendation. Is that you already built in some kind of drug-to-drug interaction or drug-to-food interaction element inside?
Okay. Drug recommendation is a recommendation for pharmacies The first is over-the-counter drug. Patient can buy free in apotheke in pharmacy. And the second is drug related problem. If patient input combination data, okay, patient can input drug they use, and then other answer several questions, and we will provide uh, our uh, our plan for the patient.
Okay, just want to know because I know that a lot of hospitals they pay a lot of money in subscribing the memes, the uh, medical information management system, that kind of thing for the drug interaction. How you can work against this kind of database which been built for 20 years?
Okay, in memes or other application, the pharmacy or a doctor in pharmacy must decided personally decided to make a best regimen in pharmacy. We deliver a personalized recommendation. Each condition it depend to condition of patient.
Thank you.
Okay, thank you very much.
Okay, the last one, Pak Rimawan.
Okay, thank you. It's a very interesting thing that this application can provide what we call it recommended medicine. How you will find that if the recommendation coming from your apps is not in line with the doctors in the hospital? So how to solve that? Because it's very important for the patient. Which one should I follow in the pharmacy from your application or the doctor at the hospital? And the second thing about the action, right now, you mentioned is about 2,000 users, if I'm not mistaken. So what is your traction projection for the next 2 years? Thank you.
Okay, our recommendation we make based on regular guideline in Indonesia. Maybe in doctor they use a panduan praktek klinis. So we also use same guideline with a doctor, but guideline, and it is for patient just access free offer the counter drug, so it can it's never contradictive with a recommendation from doctor, I think. And the second answer to the first is pengobatan, and also pharmacy for the doctor, line therapy, first line therapy, success. And the third is for with partner with drug production. In the first year, we just
Okay, time's
recommendation
up.
a generic. Okay,
You may
thank you
finish
very
your
much.
answers.
Okay, that's my answer. Okay, thank you.
Enough?
Jeffrey. Enough.
All right, thank you, Pak Permana.
Okay, thank you very much.
So the next one is Pak Satria. Mas Satria, time is yours, Pak.
Okay, Mas Jeffrey, thank you very much. So yeah, the timer start when I start, right? Can you hear me? Sorry. Just confirm. Hello?
Agak putus-putus.
Hello?
Putus-putus, Satria. Connection is bad.
Hello.
Halo Mas Satrio. Halo Mas Satria. Halo.
Hello. Yes.
Are you online, sir? Mas Satria.
Sorry. Yes. Yes, I'm online.
So you
hear me,
can
Mas
start
Jeffrey?
your presentation.
Okay. Can you hear me?
Yes, yes.
Okay. I'm very sorry for the problem. Okay. So I will start now if that's okay. Okay. Hello everyone. My name is Satria and I'm from Ctscope. Actually, this idea started. This idea started 5 years ago when my friends actually involved in an accident. The accident was happened in Malaysia. During that time, I was studying in Malaysia because we don't have identity card. So what happened was there is no medical data ready for us. So my friend has to be transferred to 3 different hospitals and repeat all the medical steps, all the x-rays and everything before actually getting the medical attention. So from that time, we realized that the integration data in hospital, in medical facilities is actually important. So we actually the CTO, and we also have a doctor as a chief medical specialist that have experience in BPJS, GE, and Institut Jantung Negara Malaysia. Actually, in Indonesia, we don't have bad drugs. We just have underutilized data. It happens because one of the cause that COVID-19 have so many victims in Indonesia is actually because the practitioner don't have the patient's data ready, so they don't have all the allergies, all.
Putus ya?
Kayaknya
Putus ya?
for him is to turn off the video and we just hear her voice.
Voice saja.
Hello. Yes.
Halo Satria, kayaknya koneksimu jelek, jadi mungkin kamu matiin video deh.
Okay.
Turn off video, voice only, ya?
Sure. Okay, thank you. Where was I just now?
Data, the health data is everywhere, cannot be accessed, and yeah, that's it.
I think this part or this part. Sorry. Or this part.
Sebelumnya.
Oh, this part.
Yeah.
Okay, I just repeat from this part. So actually, we don't have bad doctors. We just have underutilized data that proven where the cost of a lot of victim in COVID-19 in Indonesia actually because of the lack of data. So the doctors doesn't have the patient data ready before he actually handle the patient. The president of Indonesia actually promoting healthcare 4.0. But actually, we can't do that because we don't have unified medical data. We don't have big data utilization for research, and there are no data sets for government's AI program. So the AI in healthcare in Indonesia is actually very difficult. The development of AI, actually, we are using data sets from other countries. How about the hospital? The hospital itself have missing opportunities of 3,600 patients annually based on our statistics and research, and also a lot of spending on stationaries. And on the patient life in US, a quarter of million people actually died from medical errors annually, and 60% of that by allergy was actually caused by drug allergy. We don't have this data in Indonesia because of the lack of data utilization. So actually, if the problem was so big, why the hospitals is not integrating? Because there are no sense of belonging, and there are no untrustable and unstandardized data here in Indonesia, and also no patient identity unification system. So Satria in Hospital A have different medical record numbers, and Satria in Hospital B have different medical record numbers as well. And there are no trust network to actually exchanging this health information. So the solution that we are bringing to you is actually hospital information management system that will not only can be used by your hospital, but clinics and other startups as well. We use blockchain network, multi-layered verification, and also adaptive input methods. So doctors have choice to use keyboard, speech to text, or handwriting recognition for their input method. How our blockchain actually solve this information exchange? We create a trust blockchain network and also smart contract. The smart contract actually tell the system that which medical records belong to which institution, and also distributed digital identities framework and standardized and secure from the blockchain itself. We are separating the patient's data from the moment the patient registered to the hospital, the clinics, or other institutions. So they are one data that private patient information exclusive to the patient, and then protected health information that exclusive to the hospital or healthcare facility, and also exchangeable health information. This information is actually being exchanged in our blockchain system. But still, the hospital, there are resistivity in hospital to actually sharing the information unless there are orders from health of ministry, of course. So we are giving the flexibility to the hospitals to actually not sharing the data horizontally, but they are still having stream data from institution below them, such as pharmacy, clinic, and also labs, and also doctors itself. And they are streaming the data upwards to the Kementerian and BPJS. So we are creating this flexible system so that hospitals can comfortably join us. Our doctors agree. We already in talk with several doctors now. So one doctor is actually a director of the hospital, and one doctor is the pediatrician, a specialist, and also a young doctor. They agree that our solution is actually solving their daily activity of assessing the patient. So we are currently MVP ready and already piloting with few clinics in Bandung. Our outpatient module is actually can also be used by startup as like HelloDoc and AlloDoctor. So the idea is that during teleconsultation, you will get the medical records before actually the patient registered to the system. Next, we are going to develop the inpatient model and also the hospital module. For this, we are looking for collaborating with rumah sakit pendidikan. So we are developing that system to actually help 170,000 doctors in Indonesia, serving 170 million patients in Indonesia annually. Our business model is data migration from paper to digital, patients transaction, and also subscription fee from the healthcare institution itself. Our market size, we are looking at 10% of an annual contract value in Java Island, which is $7 million annually. We position ourselves in the middle of the competition, means that we are not directly competing with Heladoc, Atria, Trustmedis, Practo, you name it. We are actually the platform blockchain that everyone can use, store data with us securely. We cannot use we cannot see our patients, our partners' data because that's encrypted, and so that our advantage is that the adaptive input method for hospital system, permission data sharing, and blockchain server for other startups or other hospitals that want to integrate their data with us. Their data have to be verified when they are going into our blockchain system, and we are actually karya anak bangsa. So our roadmap is right now we are
Time's
already
up.
okay. Thank you very much, Mas Jeffrey. Yes, that's all from me. Thank you.
Thank you. Please, Pak Andreas.
As usual with this kind of platform, where do you want to start actually? Because this can only be valuable if the
Minister recommended.
Yeah, minister
Yeah.
recommended, and then adoption.
Yep. So
wide.
our roadmap is actually we are currently launching with Clinic Pratama. It's a small clinic that doesn't actually have pasien rawat enough. So from that, we are also having good tractions with the doctor. When the doctor with private practice is actually wanted to join us. So that's where we want to start. From that, we will go to inpatient module, to Clinic Utama, and then to hospitals. We are looking at ourselves as, I would like to say Gojek for data unification in healthcare, because Gojek is actually came to Indonesia unregulated. When they are having a big traction, they are being regulated.
Okay.
So that's our positioning right now. We want to start at doctors and also small clinics, and also we are having a meeting plan with BPJS Kesehatan, and also a few hospital pendidikan as well.
Okay.
Okay. Dr. Nico.
Yes, it is really interesting on the cryptoscope
Yes, Ctscope,
concept.
doc,
Yeah,
for easier. Yeah.
yeah, Ctyscope. I was wondering, it is you mentioned a lot about blockchain and crypto is actually more familiar on the cryptocurrency, right?
Yes.
Uh,
Yes.
it is quite complex for us as a medical, right,
Yep.
to understand more about the collaboration on two concepts of cryptocurrency
Yep.
and healthcare.
Yep.
And then continuing on the question of Pak Andreas about how is the reality that you are going through on Cityscope to the people or society or B2B strategy, whether it is not so easy for a company that run Cityscope, yeah, to the clinics or even hospitals. I know you have already collaborate with the RSPTN. One problem usually comes up is the the high price. How can you manage your price, right? So that you also responded very well to the business partner.
Okay. Got it. Okay, so currently we are negotiating with several rumah sakit pendidikan. I would like to hope that we can join your medical school as well, Dr. Nico. So our blockchain is surprisingly not expensive because we are developing it manually. It's not an expensive blockchain. It is actually expensive for hospital. It's around 7 million a month, but then hospitals spend around $300,000, 1 billion rupiah a year for their SIM-RS, for their SIM-RS. So I think that's justifiable. For the hospital, we are using the automated blockchain. For the clinic and the doctors, is actually very low. Our COGS is actually just shy about $200,000. So if we are selling it for four to 500,000, it's actually profitable already, and that's not counting the patient transaction as well, because we are planning to launch an app for patients as well, for their booking and managing, or not managing, for their booking medical records. It is difficult to enter the market, obviously. So we are partnering with this rumah sakit pendidikan to actually use the data for their research. So that's the goal, and that's a short-term goal. And then also the other short-term goal, we are approaching to 200 clinics by target at the end of March next year. Right now we have already 5 to 10 our clinic as far as in Maluku, Indonesia. Yep. Thank you very much, Dr. Nico. Any other question?
Pak Rimawan?
I just want to underline about what problem actually you solve, or offer of what kind of product you offer actually for the clinics or the hospital.
Okay.
And how you compete about the hospital that already have hospital information system.
Okay, got it. The problem that we're solving for small institutions below the hospitals are actually the data integration for them to send during rujukan pasien event. So when the clinic asks the patient to go to the lab, and then the lab asks the patient to go to the hospitals, we solve that ecosystem already. We are solving that ecosystem. For the hospitals, actually, few hospitals group wanted to integrate between each other, but standalone hospitals actually doesn't want the integration. So what we are offering to the hospitals is actually the comfort. The doctors can input the medical records using speech to text, using handwriting recognition. So we have other selling value to the hospitals, when then what we are offering to the clinics and doctors. To the hospitals, they want handwriting recognition, so they wrote on a tablet and converted to text. And another is that for after surgery event, the doctors have to write a long report, and it is a convenience for them to just say the report to the phone, and then the phone will transcribe the text for them. That's what we are offering to the hospitals. And for BPJS and Kemenkes, obviously we are planning to have a meeting with BPJS within few weeks. For BPJS, we are offering the data that's actually validated during the registration phase of the patient. So the verificator of the BPJS doesn't have to work as much as they do right now. So we have multiple selling values based on our customers. I think that's the and how to compete. We are actually not competing with the hospitals that already have CMRS, so they can use our speech to text module or handwriting recognition module, and then they can store the data in our blockchain as well if they want to. If they don't want to, then it's okay. It's fine by us. I think that's my answer.
Okay, thank you, Pak.
Okay, thank you, Pak Rimawan. Yeah, do we have any other questions?
All right,
from the audience?
time's up.
Time's up.
Thank
Okay.
you for Satria.
Okay, thank you very much, Mas Jeffrey.
Okay, for the last startup, we pleased to have Ali Namet. Are you there?
Yes.
Mas Rizwanda?
Yeah.
All right, Pak. Time's yours, Pak.
Okay, thank you. I assume all of the participants are already can hear my voice. So my name is Rizwanda Norisa. I'm from Alinamed. I'm a medical doctor. So Alinamed is a healthcare startup focusing on improving non-communicable disease patient quality of life and creating sustainable healthcare. Sorry. Okay. So since 1993, there has been shift of the disease in Indonesia from communicable disease to non-communicable disease. Communicable disease such as malaria and dengue fever, atau should we say in bahasa penyakit menular ke penyakit yang tidak menular. And by the research of the Ministry of Health in 2018, 71% of mortality in Indonesia, or 1.5 million mortality in Indonesia, are caused by or associated by non-communicable disease such as stroke, hypertension, diabetes, and heart disease. And these people and this group are vulnerable to the COVID infection, and they used to go to hospital, they used to go to public health service in order to visit the doctor. They need to regularly check the condition, right? And because of this pandemic, they can't because they have this comorbid and chronically ill disease. And if they are not treated, they can lead to the another mortality, and they need help. So this is what we do. We try to give them a first class a medication in front of the door, and through the home care, telemedicine, and delivery medicine. So these three service we give to the patient, made them just sit in their house nicely and tightly. So the clinic, the doctor, the nurse, and the pharmacists are going to their house solving their medical needs. So this is our portfolio for home care and telemedicine. So we already signed a non-disclosure agreement with the 5 clinics, 3 in Jombang and 2 in Kediri, and also 1 in Surabaya to implement this home care and telemedicine application we have. So we basically built the chat, voice and video calls, cashless payment, which is a must in this pandemic, and integrated electronic medical record and electronic prescription. And this is our another portfolio with one of the biggest pharmacies industry in Indonesia. I can't say the name yet because it's not yet public. So we just signed last week a 2 years contract to sell a very first stem cell product from for the beauty purpose and certified by BPOM in Indonesia, the first time. So stem cell product for beauty. And we are looking for piloting in Jakarta, Bandung, and Surabaya. And this is our social portfolio with the DKI government. So this is completely free. So we are helping them to doing a self-isolation program, self-isolation treatment for the mild symptom COVID patient. As you know, the mild symptom COVID patient can sembuh sendiri. They can recover by itself by doing the self-isolation in their home, right? So we're doing it. We provide them with the system and dashboard and application also. And we also build them a symptom checker powered by machine learning. So before they register the data, the patient, they will know this patient by the symptom checker of the how this the COVID severity of every patient that registered to the database. And also we do a daily report for this patient through the 10 to 14 days of self-isolation in their home. And we also built some, you know, if they out of the range or they turn off their phone, so the Puskesmas will get the notification. We also do the for non-communicable disease risk assessment. So by using machine learning also by 6 to 10 question, you will know your risk toward stroke, your risk toward diabetes or heart disease, and know how to tackle them. So this is a very simple our flow. So we are not only simplify the healthcare, but we also redefine because we use the machine learning in some of our flow. So we are making the money revenue stream for 10% for the total transaction for every patient using telemedicine or home care, and 2% from the capitation of the clinic for the dashboard. So this is combining subscription and the percentage of every transaction. There are 1.4 million people that having the exact same problem. They used to visit hospital regularly, but now they cannot in Surabaya. So, and we targeted GMV around 1 million with the 8,000 patients per clinic per year and 5 doctors per clinic per year. So we sell the home care for $15 and including the protective hazmat or protective suit for the doctor, because our principle is not only safe for the patient but safe also for the doctor. We sell the telemedicine for $6.5. This is our financial projection for 1 year. And what different us between the other competitor? We do both home care and telemedicine, and we work from clinic to clinic. And we also do some feature with the AI and machine learning, and we love to do a social project, and we endorsed by the government. And now we are in the phase 2. So we have the home care and telemedicine platform, and we are looking for doing piloting in November. Last year we already connect doctor, patient, lab, and the pharmacist. And currently now we are not looking for funding. We are focusing on building a success story of our home care and telemedicine platform. But in the next phase, we maybe in the December or in the beginning of 2032. So we are looking for a funding for building a portable physical examination device, which is already common in the overseas. So what we are trying to do is connecting the device and the platform we have. What I'm trying to say is making every patient a doctor for them and the family and the beloved one without going to the medical school. So that's what I'm talking about the device and the platform we have. This is our super team. So we are more like a missionary, actually. We are not getting paid yet. So we running from the same vision of improving quality of life of every patient, especially in the non-communicable disease patient. So that's it for me. Thank you very much. Join Alinamed, we create social impact. My name is Wanda Nurisa. We redefine healthcare. Thank you very much. And this is our achievement. Thank you.
Thank you. A question from Albert. Time's yours, man.
Thank you. Wow. It's good to see your roadmap from doing the connecting clinics and then go to the home care and finally getting the product robot. So can you share with us what is the challenges in penetrating the market?
Okay, thank you. So number one challenge is regulation. So home care, there is only one rule of undang-undang di tahun 2011 for the Ministry of Health, and this is the very foundation that we use for the entering the market. So number one is the undang-undang. So currently there is only one. So and the second challenge is the ability of my team. So I've been doing this with the intern, with the part-time, and we are working like bootstrap. So we are working not quite fast pace because we are collecting the money between the founders, and we try to build this software to this very moment. So that's it. The one is the regulation, and the two is the from ourselves to entering the market. The clinic itself is need. They need it. They need the software. They paid by the government, they paid 100 million by the government karena kapitasi. So this is private clinic with BPJS, and we only charge 2%. So they feel like crazy like with this offer. So that's it. Thank you.
Thank you.
Thank you. Pak Rimawan, yours, Pak.
Thank you, Pak Jeffrey. Pak Riswanda, could you explain to us about your fund right now?
Okay, thank you. So our situation right now, we doing a social project with the Jakarta government, which is completely free. So this is not generating revenue. We are looking for a pilot project with the 5 clinic in November. So just with the estimation GMV of 1 million for 1 year. So and this money is not coming from transaction. You know, the clinic they pay setiap tanggal 25 BPJS. So this is paid by the government. So we just taking from the government. So even if the one of the either the telemedicine or the home care is not working, we still get the revenue. So that's it. That's our current position, and we are doing the November for this project in the 5 clinic. Thank you.
Thank you, Pak. Return to you.
Okay, Pak Andreas.
Maybe 2 questions. One is how do you plan to compete with other players? I think including Halodoc and the team, they're also eyeing this sector as well. And number 2, as with this kind of services, usually there's a problem with scaling because you are dependent on those caregivers. Yeah. So what is the plan as well to scale this?
Okay, thank you. Maybe I will ask to repeat the second question, but I will answer the first question first. So
okay.
Yeah. Okay. To compete with the Halodoc, we already set the telemedicine to the same price with the Halodoc. Halodoc 25,000, right? So 25,000 per every consultation needed. So we already have the same, and our marketing strategy is not bersinggungan dengan the Halodoc because we are working with the clinic. Clinic already have a member. So one clinic in BPJS already have 10,000 members. So we assume with our marketing strategy with the 20% of the conversion, we already have 2,000 member to work with. So with the 5 clinic is 10,000. So we basically dominating the member of the clinic now, and we are not competing with the BPJ, the Halodoc or the Allo Doctor. So we're basically improving and we are making the clinic rich so we can get rich together. So something like that. Because they pay by the government. Something like that. Thank you.
I see.
And the second question?
Is there a follow-up question on that? Is it sustainable in the sense serving this BPJS? What is your plan to offer on the next iteration, and also the scalability? Yeah, that's my second question actually.
Thank you. So the first one, working with BPJS will be great because nilai kapitasi akan naik dari 10.000 to 20.000 per orang. So with the clinic yang kita kerjasama di Surabaya with 10,000, so uang duduk mereka tuh 200 juta per bulan, dibayar setiap tanggal 25. So this is a new way of medicine. So kita nggak berdoa orang sakit, kita akan berdoa orang sembuh sehingga the money we don't have to membelanjakan uang ini untuk pasien-pasien kita. So this is the upside of working with the government and working with BPJS right now, especially in clinic. Bukan puskesmas, only with clinic. Karena puskesmas they have different, and hospital also have different. Clinic mereka tidak pernah tolak klaimnya, berbeda dengan rumah sakit. So that's why we are working with clinic. and not Puskesmas also. And scalability, yes, scalability. There are 1,000 private clinic in East Java. So there are 1,000, and we are planning to get 100 clinic in East Java with the model of in the future 3M. So we put our money there. So like more we also not only give the technology, but we do give them how to manage the clinic, because with our platform, and how to scale the clinic. So like a consultant, something like that. So we make them the clinic rich in order to get rich to our startup. So something like that. And they always paid by the government by tanggal 25. So I think this is a win-win solution between clinic, patient, and the platform itself.
Okay, Dr. Nico.
Yes. Okay. Hello, Riswanda.
Hello, Doc.
Hello. How are you? Yes.
Yeah, it's very good.
I will ask something quite principle, because I know quite a bit about Alinamed and yourself as a founder. The only problem that I want to ask is that I know that you are spending all the year, a year you said, for this startup, for this brand. What will be happen in the next year? Because it's I really noticed that you giving your chance for this year for Alinamed, and what about the next year and the next year? Because sorry to say, it's just also personal. You mentioned about 25th of a date payday for BPJS, but 25 is also the age of your future family to be on. So what happened? What is your plan to deal with it? Because Alinamed without Dr. Riswanda is also worrying about. So what is your plan to deal the problem?
Okay, thank you. So Pak Rimawan, Pak Andreas, dan teman-teman sekalian, Dr. Niko ini dosen saya. So he's asking about my personal cycle in doctor, ya, dok. So before I answer that, so I've given my chance of becoming a doctor 1 year of my study in order to focus on Alinamed. So I have my college already have sudah praktek semua, dan so I'm still here doing this because I'm committed to this this startup, especially in doing this to non-communicable disease, chronically diseased patient. So Dr. Nico, so we have 2 years time window for me to get my doctor degree. So there will be 2022, and I'm okay with that. So I already told my team about this. So I will give them 2 years of my study education. So we have to scale to 100 clinic in 2022. And by the 2021, we have the funding for doing this physical examination device, because the physical examination device is already common in US, in Israel. The prototype I showed you earlier is already sold in US for $300 from Ctscope. So this is very inspirational for me to do it, and to build the platform and also the physical examination device, and also build the portable clinic and take it to the every Indomaret possible in Indonesia. So this will get big. I believe the vision and my team also. Thank you.
Okay, this is our last startup to pitch. So we glad everybody on this time. We will break for 10 minutes. The judge will discuss what will be the winner of this pitch session. I will let everybody on break for 10 minutes, and now we will back to the judges. Thank you.
Jeffrey?
Udah bisa dimulai?
Yeah, okay.
Okay, everyone, let's have continue the event. And this turn will be announcing the winner. Not further ado, I will continue to my colleague, Dr. Bimo will announce the winner.
Okay.
Time's yours, Dr. Bimo.
Good afternoon, everyone. So for the participants here, we are still seeing like almost 50 people. So I think it's okay, and I would like to share the polling result first. So this is actually just a polling for you guys. You can see now so this is not the jury scoring, but yeah, you will see. You will see something from this. So we see that your favorite startup, 33%, Alinamed. Who do you think will be the winner? There is a tie between Gigi and Alinamed. This is opinion, right? This is opinion. Okay. Yeah, you can all see, right? Oh, this is opinion. Now, we are going to go to the interesting parts. So the jury have discussed all the scoring. Basically, what we see is first, the jury is scoring you based on the market attractiveness. So each startups score from Brave, Madeena, Gigi.id, Farmasee.id, Ctscope, and Ideanesia. This thing evaluating how is the size of your market and the growth or the maturity of the market, and also to the competition that in the sector that you select. Okay. The second one is the business model. So we are seeing the evaluation of the feasible, scalable, and innovative business model. The third is of course the team, your team, how good and how are you willing to do something and even sometimes sacrificing for your own venture startups.
Ada ibu nih.
So the fourth is traction, and the last is since you are still in a pandemic of COVID-19, the benefit to solve the current problem in the pandemic and how will this impact in a COVID-19 pandemic. So from all the three jury, we are seeing for all startups, the market attractiveness is 50% is so we score between 0, 1, 2, 3, 4, 5. 50% is in the score 3. Business model also like 60% in the score 3. From 0 to 5 scale. Team is mostly 3. Traction are, yeah, this is I think because this is 0 to 2 years old startups. It's between 0 to 3 mostly. But benefit, it's around like 3 and 4 score out of 0 to 5 scale. So it is really interesting to see how growing of the health tech solution in this COVID-19 pandemic. And we would like to announce now the winner and the runner-up that has been discussed by the jury. Usually there is some delay and some technical issue.
Drum roll, please.
We don't have drum roll.
Nggak ada ya?
Nggak ada. Wait. Let me share screen and hopefully not the wrong screen. This one. Can you see it? It's all everyone. So the winner of the Indonesia Hong Kong AI and Deep Tech in Healthcare Startup Pitch for Healthtech Ideanesia 2020 is not working.
Yay!
This one.
Yay!
For
wow. Thank you so much.
Congratulations.
Wow.
Armelia, are you still here, or the team, Soleh, Ardi?
Yes, we're still here. Thank you very much.
Thank you
very much
for your participation and all your effort to create a solution for the condition. I mean, we haven't seen the teledentistry for a long time but I think since the COVID-19 it must be here, right? And Alinamed is really interesting model, and I think you also do it a year stop from your school. Okay, any commenter on any other comments from the jury, perhaps? Surya?
Better comment from the winner, I think.
Yeah.
Okay. Any speech from the winner, Dr. Reswanda?
Okay. I don't know. Thank you very much, Pak Andreas, Pak Rimawan, Dr. Nico, and the Healthtech.id for the holding this very comprehensive meeting. So yeah, thank you. I'm not planning to win, so I just deliver my idea. So I don't know. Thank you. Thank you so much. It's very honor for me. Thank you.
Okay. Is Dr. Armelia still here on the team?
Yes. Hi, this is Ardi, representing Gigi.id. Would like to thank the organizers for this opportunity. Again, I think it's fantastic to be able to hear the different ideas and be able to network. I think for us, we appreciate the validation for our business case that we presented. We hope that the relationships can continue beyond the event today, both with the judges as well as our fellow startups that we've met today, so that we can build a good community and a better Indonesia ahead. Thank you so much.
Thank you, Pak Di. Okay, so I think I will get back to Jeffrey to close the session.
Close statement aja, bro. Close statement from head of the committee of Healthtech Association. Closing statement, sure.
Okay, So thank you for Hong Kong Economic and Trade Office, Invest Hong Kong, Cyberport to support our event today. This has been a great pleasure to work together for Indonesia, Hong Kong, and also I would like to thank also the Ministry of Research and Technology for delivering the speech. Minister himself, Professor Bambang Brojonegoro, this morning, Ministry of Health, represented by the Secretary General, Dr. Oscar Primadi, and Ministry of Communication and Informatics, represented by Pak Nyoman Ardiana, from the Director of Digital Economy, and also would like to thanks for all the association that helped to all the team in Healthtech Indonesia and other associations who help to share and work together with this. Nonetheless, the Indonesia Venture Capital for Startup Indonesia, AMVESINDO, for a great help, and especially for the last session, Startup Pitch, Pak Surya, Pak Rimawan, and Dr. Nico. This has been, I think, quite interesting, and although the pace is very fast, everything happened like yesterday. So I would like also thank you. Albert is still here. Thank you for your time from Hong Kong and to see and work together. Thomas also, Andy, I think already left. Okay, so that's all for this afternoon. It's quite been a full day event. It's like a work day for us actually. So have a nice weekend and keep doing the best in health tech. What we want, so like my opening this morning, business can have winner, but we cannot afford losing people, right? So even though the health tech supporting the healthcare as an industry, we need revenue, we need growth, we need traction. But at the end of the day, what we all do is helping people getting healthier, helping people becoming more of themselves, becoming a better nation too, as the Indonesian Vision 2045 that we all support. So that's all from me, and see you again next week. We are still having a session next week and the week after.
Okay, thank you everyone.
Okay, thank you everyone.
Thank you.
Thank you.
Have a good day semua. Bye.
Thank you semuanya. Bye.
The committee will contact all the winners, right?